Hello everyone, welcome to Move Well, Live Well. We get a number of people that come in here with issues regarding their abdominals. And what's going on with these folks, they're getting weird complaints such as gastrointestinal type complaints like heartburn, nausea, sometimes they vomit, that nausea, discomfort, and they want to vomit. Sometimes even diarrhea, and even symptoms of diverticulitis, pain and discomfort in this entire region here, the abdominals. Also, pain including low back pain, pain across the back, kind of across the belt line into the SI joints. Sometimes even mid-back pain, like the base of the rib cage, back in through here, base of the rib cage pain through here. Also pain in the kind of right here, the epigastric kind of region, kind of where the xiphoid process is, kind of like heartburn type symptoms, and even gynecological symptoms, pain in the groin, in the genitalia, and the testicles, and also painful painful cycles for women. So what's going on here? Why are they having all these weird, diffuse, all these kind of symptoms? And they're getting, sometimes they go see their MD and they're getting diagnosed with diverticulitis and all this stuff, and then but all the tests are coming up negative. So they've gone to see their MD, they don't know what's going on, but they're still complaining of all these weird symptoms. So what's going on here with these folks is they're experiencing, believe it or not, the rectus abdominis, which is kind of that six-pack musculature right here in the abs, your abs, the six-pack. Well, let's face it, we sit a lot like this at our desk. Here we are again, talking about, in that posture again. And these muscles, especially where right here where your hips meet your abs, your hip crease right here, this hip crease, these hip flexors, where you meet the abs right here, this is always in its compact seated position. So these lower abs are always kind of in a cramped up, contracted, right? Because that's what the abs do. The abs, what they do, they help bring the rib cage toward the pubic bone, right? Because that's where it attaches, the pubic bone. So the rib cage and the abs span here, and they contract, they bring the rib cage toward the pubic bone. And right there, just above the pubic bone, those lower abdominals get really, really nasty. And even the upper ones get kind of nasty. And they're giving us all these GI complaints. Heartburn, nausea, vomiting, even symptoms of diverticulitis, even symptoms of appendicitis. But then they go to the doc, they go to the MD, and all the tests come back negative, and they send them home, but you're still having all these problems. So then they prescribe all kinds of, heartburn medication and pain medication, all this stuff. And really what's going on is trigger points have developed and adhesions have developed all in this abdominal region. So how do you fix that? How do you alleviate some of those problems? Well, what you do is you get yourself a good old lacrosse ball to start with. And sometimes these can be very, very sensitive. So sometimes a lacrosse ball may be a little bit too aggressive to start with. But what you do, you get a lacrosse ball here. You get yourself a good old kettlebell. And you search around. I like to start, again, distal to proximal towards your heart. So I'll start low, just above my pubic bone. I can get this lacrosse ball and start searching around in here for pain and discomfort. See that? This kettlebell is great because then I don't have to push down. I can just allow gravity to hold that. That's pretty clear on that side. But right here on this left side, I can feel a little tenderness right there. And I can kind of feel that kind of shoot into my hip. I can feel that kind of shoot a little bit into my SI joint in the back, the sacroiliac joint. A lot of people have sacroiliac joint pain, and a lot of it is due to these abdominal trigger points, these down in through here. The lower ones The trigger points, the lower ones, have a tendency to shoot pain into the groin, into the genitalia and stuff. So painful cycles, that type of stuff, that's a lot of it's due to trigger points in the lower abdominals. If this is too aggressive for you, this is kind of a softer thing to start with. This is kind of like a medicine ball. It's a 4-pound workout medicine ball, but you kind of see it's pretty soft. I can squish it and it's pretty malleable there. So you can do this lying prone if you want. If the lacrosse ball, again, if the lacrosse ball is too, if you're really sensitive and the lacrosse ball is too hard to start with something like this, a little more softer. And you can get in here and you can find those areas this way and use your body weight to kind of give you that pressure. Like right there is pretty sore for me. So I can just let my abdominals melt into, you kind of see that, you see that ball? I can let the abdominals melt into there. This is a lot more forgiving, this ball. It's a lot more comfortable, if you will. None of these are very comfortable in and of themselves. And you can kind of see here, I'm kind of rocking back and forth. There's really no right or wrong way to do this here. All I'm doing is trying to break up some of those adhesions that have developed between the skin, the adipose tissue, and the fascia and musculature of the abdominals. Because, you know, we spend a lot of time sitting, and especially the lower abdominals, these guys can get pretty matted down. These tissues get matted down, causing all kinds of symptoms such as heartburn, nausea. You get nauseous, so then they want to people want to vomit. Even symptoms of diverticulitis is because of this stuff. Even symptoms of appendicitis. People freak out. They're like, oh, I think I'm having appendicitis. What's going on here? And they go to the doc, they go to the ER, and everything's clear. And so I recommend they start with this. We go around, we start palpating through here, and man, it is tender stuff. It's hard, it's tender, and it's causing all kinds of referral pain up and down the abdominal region. So now I'm gonna go to this side right here, and I can find right in here, yeah, right there, that's a good spot for me right there. So again, I'm just kind of oscillating back and forth on this thing, just kind of like loosening that up. And sometimes you can even do a contract relax, where you kind of contract the abs and then relax, and then contract the abs and relax to allow that ball to melt in through there. If you don't have one of these, another great way to start, that's not as aggressive as this. You can also lay face down on this too. This is good. You can get the lacrosse ball and lay face down on this and get in here and work these guys. But with the lacrosse ball, it's not so, the height of it is not so high as this one. It's best to lay on your back and then use the kettlebell in here for the abdominals. See that? Right there. And you'll find sometimes when you hunt around, you might even get into the psoas. So as you get into the psoas too, you'll find sometimes pain shooting in the groin, that type of thing, top of the thigh. As you go around and through here with the lacrosse ball, you'll hit the psoas, because the psoas is down deep in through there as well. So you'll find some junk going on the psoas as well. But anyway, these are all kind of tied in together, giving us problems such as especially gastrointestinal type of issues. And really all that's going on here is you're having abdominal trigger points, which is one of those weird kind of things. You go to the MD, they clear you that nothing's going on, and what's really going on is you've got trigger points into there. Another tool you can use that I kind of like before I do any like upright work or overhead type of exercises, it kind of helps stretches the front out right here, is to get a good old foam roller. And the foam roller is great. What I do is I just kind of start out like here on the foam roll, kind of just above my pubic bone, and I can just above my pubic bone, I can kind of just rock back and forth on this, and I can even do kind of a Mackenzie type of a little bit of extension in through here, and man, you can feel the abs just stretch over the foam roller here, and I can just oscillate back and forth on that, those lower abs right there. And man, that is like right there, woo, that's a good one. And you can kind of really feel the sensation of all the different diffused sensations in my abdominal region just by foam rolling over the abs in this manner. So I go into a little bit of extension right here like that and just oscillate back and forth on those lower abs, and man, woo, that's a good one right there. And then when you go to stand up, you can just get more, when you go to stand up, you can just get more, you can feel like you get more in an upright position after you work those lower abs in through here, right up above the pubic bone. As you do that, you can feel you can stand up a little more, you can get a little more hip extension in through there, and just feels you feel just more upright. So anyway, if you have any questions with this video, obviously drop them off in the comment section below. We thank you for watching. We appreciate it. Please give us a thumbs up. It lets us know you care. And if you're new to this channel, go ahead and hit subscribe. And when you hit subscribe, make sure you hit that bell notifications button. That way, you don't miss any videos coming here in the near future. So that way you can continue to move well and live well. And I know you know people who have GI issues, all kinds of gastrointestinal issues, and they're not being, they've gone to the MD, they've gone to their doc, and they've been cleared, all the tests come up negative. Share this video with them. They may be experiencing trigger points in their abdominals, and that way they can continue to benefit from these videos as well. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.